Hello friends, I am Dr. Shayantan Banerjee. Let's discuss with the COVID vaccines today. Lots of my patients, they used to ask, sir, which vaccine to use, whether it is Covishield, Covaxin or the Sputnik V or the Pfizer Moderna vaccine. Whether I can use this vaccine, I have heart disease, I have kidney disease, I have allergy. So let us discuss with the vaccines first, and we will come to each and every questions in a manner that everyone can understand. Please like this video and subscribe my channel of RR Healthcare, and please share this video to others so that everyone can know about the vaccines. In today's video, we will start with the Covishield. So what is a Covishield vaccine? It is the AstraZeneca counterpart, Indian counterpart vaccines. It is the same vaccine as the Oxford AstraZeneca vaccine. It is produced by the Serum Institute in Pune. So the vaccine is produced by in form of a non-replicable chimpanzee adenovirus vector containing the M spike protein. Not going into too much of science of that. That means that this vaccine, if goes inside your body, cannot produce any disease. That's why if someone asks the question, if the persons who has a low immunity, like a cancer patient, like a person who having some disease like HIV, can take the vaccine. Yes, they can take the vaccine, but the immune response will not be that much compared to a immunocompetent person, like a normal person. Okay, can it be taken in the pregnancy? No, there is no data, and hence it is not given in the pregnancy. Can it be given in the lactating mother? Yes. Now, recent guidelines of the Indian government, they show it definitely to use in the lactating mothers. Now, there are some controversies regarding the use between the duration of use between the duration between the two vaccines. Now, initially, with the healthcare, we used to take the vaccine after 4 to 6 weeks. Nowadays, they recommend to take the vaccine after 12 weeks. What is the benefit? So let me clear it. Some confusions are there. Some people, they thought that this is due to the non-availability of the vaccine. But actually, the study shows it will produce 81% or more effectiveness if given after 12 weeks. So giving second dose of vaccine after 12 weeks will be very much beneficial. Okay. And if someone gets the first dose of vaccine, when we will get some amount of protection from the coronavirus? The answer is, it will be, all the answers are from the data as per the UK and Brazil different studies. I will come with that and will show the data also. So the first question is, if I get a first dose of vaccine, after how many days I will get some protection, and how much protection from the coronavirus? So in case of Covishield, we are discussing today regarding the Covishield. In case of Covishield, it will be after 22 days, you will get approximately 75% or 76% of protection from getting infected from the coronavirus. Another good thing is that the transmissibility, that means you transmitting the virus, the probability of it is also get minimized. And after getting 2 doses of vaccine, and if after 2 to 3 weeks of getting the second dose of vaccine, you will get approximately more than 80% of protection, as different data show. So no vaccine is absolutely foolproof, but it will give us lots and lots of protection, and the chances of severe disease or death is almost negligible who are vaccinated individuals. This is also I have seen from my practical experience from my OPDs. So vaccine is essential. Covishield, some amount of side effects are there, but these are very negligible. The serious side effects are almost not there. This vaccine can cause some amount of say fever to someone, or some rashes, but it will go within 1 to 2 days. The drug only you can take for these problems is the same paracetamol for muscle pain and fever, and it will go away. The vaccine is very safe. Everyone should get it, the fast vaccine. And if next question, let us discuss, if someone has got 1 dose of vaccine and then get infected by the COVID, so what to do next? Next, you have to wait for 90 days, then you will get the second dose of vaccine. Another question arises here, if I got 1 dose of vaccine and by somehow, by any means, the 12 weeks window period has gone, I have forgotten it, or can I take the second vaccine anytime after that, or I will have to start it from the beginning? No, you cannot start from the beginning. You have to take the second dose. Take it as early as possible, not to not to delay more than 16 weeks if possible. Otherwise, single dose of vaccine is also protective for some instances, but getting 2 doses of vaccine will definitely give you more and more protection. Can I take another type of vaccine after getting Covishield? I think it is not there in the trials, and you should not do this. You should take Covishield if you take Covishield in the first instance. Okay. Some question asked, I am allergic to prawns, to egg. Can I take Covishield vaccine? Yes, you can take Covishield vaccine, because if you are allergic to the ingredients of the vaccines, which was written in the paper there, then only you are not allowed to take the vaccine. Otherwise, having allergy to some drugs or some food, you cannot think about not taking the vaccine. You should go and take the vaccine. Okay, this is very much important. Don't worry about the allergy. If you are allergic to prawn, you may not be allergic to the vaccine. I ask my patients any questions. You have taken vaccines previously, like the tetanus vaccine and several other vaccines? Most of the ingredients of the vaccines are same, almost same. The particles which are required for the vaccines to make it in a stable condition. So I used to ask, have you ever got any reactions after taking any type of other vaccines like tetanus, toxoid, or anything else? They used to tell, no sir, I don't. Then I don't think you will have any problems of allergy after taking the COVID vaccine. So again, we will start discussing about the Covishield. So the duration is now about 12 to 16 weeks. So it's better to take your second vaccine at 12 to 16 weeks. We'll come with the data and we'll show you the data, how much important a vaccine is and how good it does. So it's all for today. I think I have questioned almost everything. A little bit more, the patient on anticoagulant and antiplatelet drugs, the heart patients, you need to continue your medicines. You ask your cardiologist. Sometimes cardiologists can check your blood to say whether there is a bleeding tendency or not, particularly those who are on anticoagulant, and then they ask you to stop for a few days and then take the vaccine. So you ask your cardiologist regarding that. And with the antiplatelets commonly given to the heart patients, it is not a contraindication at all. So go get your jab. And the Covishield is a very good vaccine, and it is the same vaccine as the Oxford AstraZeneca vaccine that has been given in the UK. Okay, thank you for listening to this video.